And I wish we had more in the vet space, especially. This is such a hot area in human medicine of how can we test for or prevent kind of early onset dementia, early onset Alzheimer's. What can we do to kind of prepare for that and be proactive? This is common in dogs and cats. And, as they age and pets are living longer, we know it's going to be more common in our older patients.
Welcome back, everyone, to VetFolio Voice. This episode is sponsored by Hill's Pet Nutrition, and in it, I was joined by Dr. Catherine Ruggiero to talk about a new food from Hill's for our aging patients that features benefits for both brain health and joint health. It brings me back to the exam room and something I think we've probably all heard. He's slowing down, but that's okay. He's getting older. It's normal. Personally, I don't know that I buy into the idea that slowing down is inevitable in our pets. Although, if my nutso boxer puppy would like to slow down just a little bit, I would not be upset about it. I've not ever had a boxer before, and yeah, she's a little wild. I don't think anyone warned me that they were quite this energetic. But anyhow, I digress. In my experience, when it comes to managing our patients, slowing down often signals an underlying issue that we have the opportunity to address, even if it's not something that we can fully cure, so to speak. Osteoarthritis and cognitive decline are certainly common culprits in aging pets, and while of course we can't cure either one of them, we do have multiple ways to manage them, one of which is through nutrition. For a long time though, we've kind of had to choose which one of these conditions to prioritize when we're talking about therapeutic nutrition. Not anymore though. Dr. Ruggiero and I dive into a new therapeutic diet that supports both brain and joint health, so we don't have to choose between the two when we're talking about nutrition. It's another tool in our toolbox to help our aging patients live not only longer, but with a better quality of life. And for those of you wondering, what about aging cats and kidney disease and these other things that we have to deal with when it comes to our aging feline patients? Don't worry, we absolutely cover that too. Let me tell you a little bit about Dr. Ruggiero, and we will go ahead and jump into our episode. Dr. Catherine Ruggiero is a board-certified veterinary nutritionist and senior manager of scientific communications at Hill's. She holds a bachelor's degree from St. Lawrence University and a master's in biological sciences from Fordham University. She earned her DVM degree from the University of Missouri, where she later returned to complete her residency training after several years in small animal practice. Upon completion of an ACVN residency program in 2019, Dr. Ruggiero joined Hill's Pet Nutrition as a consulting clinician in VCS, then became a member of the U.S. Professional Veterinary Affairs team in scientific communication. I'm so excited to have her here on the podcast. She was wonderful to talk to. Let's go ahead and get into our episode.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Well, thank you everyone for joining us. I'm so excited to welcome Dr. Catherine Ruggiero onto the podcast. We've recorded before in a vet-to-vet capacity, but I'm so excited to have you come on the podcast.
Oh, thanks. It's really great to be here. Thank you for having me.
Absolutely. Absolutely. And we're going to talk about a couple of my very favorite things. So options for feeding our pets, and then, kind of a little bit here about aging pets as well, which I love talking about both of those subjects. So let's go ahead and dive in a little bit. Can you tell us about some of the options that are now available for feeding senior pets?
Yeah, this, has been a really exciting year for Hill's Pet Nutrition. We have a bunch of new innovations, brand new diets coming to market. And, not that they need to be exclusively for senior pets, but they're really nice profiles nutritionally for our aging dogs and cats. We have not forgotten about cats. Probably the one I'm the most excited about. It'd be hard to pick a favorite this year, but we have a brain care plus joint JD diet coming for both dogs and cats. And so that is coming in March of 2025.
Wonderful, wonderful. And that's yes, and that was where kind of my mind was going with aging pets, thinking about the brain diet. I have certainly fed that to my senior pets before and recommended it pretty regularly for brain health and aging. But of course, I love that Hills kind of recognized we also have a lot to do in terms of managing joint health because really, keeping animals out of pain, keeping them moving and active and engaged can go a long way when it comes to helping with brain health. So I love that's kind of the combination that it was put forth.
Yeah, and we've had on the dog side anyway, we've had BD for quite some time, and that's just been an amazing diet for cognitive dysfunction in dogs. So this has all the beautiful science and studies behind what went into making BD, but it's elevated with that joint health built in as well. So, you're totally right. I mean, we know more than ever that especially as pets get older, they don't have just one disease, and especially, things like brain and joint health. It's a really natural marriage. So this diet is truly an upgrade to what has been around for a while, which is Hill's prescription diet BD, but now it's getting all of the amazing technology and nutrient profiles that go into JD. And when it comes to joint health, we know, I mean, as far as the supplement world goes and things like that, there really are not that many solutions or that many options for pets that have joint disease that are really proven to be efficacious outside of joint diets. So JD is a great diet. We've got such fantastic results with that food in terms of improving, dogs' ability to run, jump, play in as little as 21 days. Now that's combined with a diet that's also appropriate for those signs of cognitive dysfunction. And then really exciting, I've had those foods on the dog side for a while, but now we have them for cats too. And definitely our feline patients are getting older, living longer, and we know that both joint disease and cognitive disease are two diseases that definitely occur in the feline population, but are probably a little bit harder to detect. And they're things that owners may not appreciate all those changes associated with aging that we can actually do something about. So this diet it's a really exciting one, especially on the cat side. Obviously, both those diets have been great for dogs, but now we have really something truly new and innovative for cats, especially those older kitties.
Absolutely. I mean, it's always a little, tugs at my heartstrings. Speaking of cats, when you have these older cats and maybe they've lost some muscle mass, and you can kind of detect that tenderness maybe in their spine and their hind legs, and but they hide it so well. So owners can really have a hard time picking up on it unless they really know what to look for, and we know how to ask the right questions. And I love that where there's more and more focus on aging cats, especially when it comes to joint disease and things like that, because they do hide it so well, it can be hard to pick up on. And it seems like for so long, there wasn't as many options to address that in cats. I think we're having that conversation more often now. So, to your point, to be able to address joint health, which has been an option, but combine that with brain aging and some of these diseases that can be really subtle in cats is exciting.
Yeah, I'm really excited. I mean, as I look at my own household of senior pets and I look at my own cat that's getting up there into her mid-teens, it's going to be really nice to have these options for those conditions that we know are occurring, whether we're picking up on them yet or not, or we know at least statistically are bound to happen. So yeah, I'm really excited. I think this is important for just overall quality of life of our pet family, and owner quality of life too, because both of cognitive dysfunction and joint disease have such a huge impact on that human animal bond, whether we're talking about dogs or whether we're talking about cats. So if we can intervene and help either lessen or delay some of those symptoms, it's going to be such a great thing for pet households.
And thinking of BD, like I said, I have absolutely fed that diet and seen positive effects. It's almost my feeling on BD is like it's one of those where you almost have to see it to believe it because you think antioxidants and you're like, antioxidants are they gonna have this dramatic effect on the aging brain? They do. At least I that's been my personal experience. So kind of along those lines, can you talk to us about the ingredients in this combination diet that are really going to benefit joint health and brain health?
Yeah, when it comes to brain health, you're absolutely right. I mean, it's really the antioxidants. So things like vitamin E, vitamin C, selenium, beta carotene. We've got a whole bunch of, phytonutrients, flavonoids, carotenoids from fruits and vegetables. I mean, it's the same stuff we know is so great for us as we age, but we've really been able to isolate a particular blend that we can show improves those signs of cognitive dysfunction. And the original studies that were done with BD are still, as a nutritionist, I'm such a nerd about those studies, and they're still some of the most elegant cognitive studies that were, I think were ever done. So I like to go back and read those studies and kind of nerd out on those because they really showed such significant improvement in the population of dogs that were fed BD. But as you said, you kind of have to see it to believe it too. I've recommended BD historically to folks who maybe were a little bit skeptical, and I said, give it a month or two and let me know what you think. And I think it's even signs owners don't appreciate makes such a big difference. And it really comes down to that blend of antioxidants, that blend of mitochondrial cofactors, that blend of phytonutrients that has such a profound impact on helping to kind of break that cycle of free radical damage and of oxidation that we know is associated with aging, but particularly for the brain. And then when it comes to, joint health, it's so much of it is based on those high levels of omega-3 fatty acids, particularly the, EPA and DHA levels that come from marine fish oil. We know that anti-inflammatory benefit we get from therapeutic levels of fish oil can be a game changer for joint disease. And that's really the combination of things that make up brain care plus JD for both dogs and cats. And then you kind of package that together with just a really robust, complete, and balanced food that's also super palatable and tasty because if they won't eat it, it doesn't make a difference how great it is, right? And you put that all in a package with something that also has a really nice kind of senior profile in case there are some early, concerns about things like early renal dysfunction or early cardiac disease. And you kind of package all that together in a diet and you get this really wonderful brain care plus JD.
That sounds phenomenal. Yeah. I mean, because high levels of EPA and DHA, like you're talking about, they can be hard to achieve, especially in the supplement world. So, and to not have to purchase an extra supplement, to not have to give an extra pill and just like you said, package it all together. And then add in this beautiful combination of antioxidants and things that are so good for us and for our pet. I love that you named the antioxidants because every time I hear them, I'm like, oh yeah, I forgot that's what those were and that's how they were working. It makes the ingredients very, very tangible to say, oh yeah, that makes sense that putting that all together would be beneficial. I also love that you brought up, doing this senior profile because we talked a lot about cats a little bit ago. And certainly kidney disease is one of the major things on our radar when it comes to cats. And there is a KD and a JD combination, but with this one more focused on joint disease and knowing that also will play a big role in quality of life and in cognitive health. Would a diet be appropriate, say, for a cat with really early renal disease?
Yeah, it's a great question. And I think it always ends up coming down to prioritization with especially our older pets, right? And whenever there's more than one disease or one, clinical sign. And I can't ever under undervalue the KD products. I think they really are the only intervention that's been shown to improve quality and quantity of life in dogs and cats with chronic kidney disease. So absolutely, like I will always scream from the rooftops how amazing KD is for a patient with kidney disease. But it's a prioritization thing. And if there are patients with very early, maybe suspicion of renal dysfunction, but they also have cognitive changes, it comes down to that conversation about quality of life, right? And what is really impacting this pet and this pet owner on a daily basis. And if we don't have confirmed kidney disease or it's very early and we also are having these signs of cognitive dysfunction, then Brain Care plus JD just is such a nice option for those. And I would feel totally comfortable using it in one of those patients with kind of early concerns about renal issues. As their renal disease, progresses, then we know we want to go with the best evidence-based, intervention that we can, and that would be KD plus JD. And that's still going to have our joint benefits there, but we're going to lose some of that kind of unique antioxidant blend that's in Brain Care JD. So I always look at, nutrition being this iterative process where we're re-evaluating at every visit what needs to be our prioritization here. And so I think for those cats where, again, it's early or you don't have any signs of renal disease, you start them on Brain Care JD, they come back for that, 6 month senior exam. And now, oh, wow, they're azotemic and we're starting to see some of the clinical signs associated with chronic kidney disease. Then we can always kind of reassess where are we in our cognitive issues? Where are we, in our renal issues? And that's where that partnership with the pet owner to make a decision of where do we go next is important. But it's nice that we have that option to say, where do we go next, right? There are a lot of next steps and next options where we can really customize that nutritional therapy to that individual patient and that individual, family that's in front of us in the exam room.
I think you just made so many really good points there. Talking about nutrition being this iterative process that we revisit every time. We talk about it as what do we call it? The fifth vital
Yeah,
sign. Is
fifth
that
vital
what
assessment.
I was like, how I'm
Yeah.
counting now. I'm like, I think I know this off the top of my head, but all of a sudden I'm confused. Yeah, so the fifth vital assessment and making sure that we're revisiting that, kind of like you're talking about to really make sure we're prioritizing what problem is affecting this patient's quality of life the most and that we're addressing that the most aggressively. Because if I'm hearing you correctly, when we're talking about cats with early renal disease, there are ingredients in this diet that can absolutely be beneficial for all of those joint systems, for kidneys, for brain health, for joint health, probably other
Yeah,
systems in the body as well. So it's not that there would be any sort of like contraindication. It's just that as that kidney disease gets to a certain point, the KD is probably going to be more beneficial for those kidneys in the long
exactly.
run.
Yeah, exactly. And when you look at, the iris staging guidelines, for example, and, for both dogs and cats, those early iris stages, even, the iris consensus can't decide when exactly we should put these guys on a renal food. And so I think it's that I always advocate for earlier the better, right? I mean, we know renal diets work so well, and there really aren't any adverse effects of doing that. But if you've got something else going on, like cognitive dysfunction, then it's nice that we've got, again, like an option that can be good in the early stages. So, Brain Care Plus JD still has really nice controlled phosphorus levels, for example, has really nice controlled sodium levels. I mean, those are two of the minerals we care really the most about keeping at those kind of lower levels in kidney disease, regardless of the stage. The protein levels are not what I would I ideally want for a patient with chronic kidney disease, especially one that has proteinuria. But, we also have the high levels of omega-3s that we know help kidney health too. So there's a lot kind of packaged into the Brain Care Plus JD products that take into account that we know just statistically the patients you're going to select to put on this food are going to have a higher chance of developing chronic kidney disease or being in the early stages of CKD. And so this food is absolutely appropriate for them in those early stages. And again, even if you are talking to owners in late stages, if brain health is your priority, this is the food for that. And this is the food that we know is going to be the most impactful for that. So it's a nice option. It's not a clear cut one. I think it's certainly doesn't have all the bells and whistles that Katie has. But in those earlier stages, I wouldn't hesitate, yeah, to use this in those early stages. And then you monitor these guys, knowing that they're not truly on a renal food. So, and then decide when and if you need to make that switch over to something like KD plus JD.
And I love that you kind of left it fluid. That is so freeing listening to those recommendations as a general practitioner from a nutritionist, to say you make sure that you're having these conversations and that, if brain health really is the priority here, that's where we're seeing the issue. That maybe it's okay to really focus on that when we're talking about dietary therapy as opposed to the kidneys, because we're really focused on quality of life here. When we're thinking of brain health in our aging patients, I mean, just realistically, there's so many things that can point to cognitive decline, cognitive dysfunction in animals, but sometimes in these appointments, especially if we're talking like annual wellness exams and stuff like that, there's so much to cover during those exams that it can be hard to really dive deep into those conversations if the owner isn't aware that is kind of rearing its head in their patient's quality of life or in their pet's quality of life. All of that, but to get to the actual question, which is, are there tools out there to help assess brain health in aging patients to maybe get us to that conversation a little bit more efficiently so we can fit it into everything else we're trying to cover during these exams?
Yeah, absolutely. And like most things in vet med, we're a little farther along on the dog side than the cat side, right? In recognizing this just as a vet profession and owners recognizing it. Hills Walvis, we were getting ready to launch this diet, worked with Dr. Letitia Finucci to develop some cognitive assessment tools. And so really she brought in this wonderful behavior perspective of how do we look at these behavioral signs and how do we ask owners to look at these behavioral signs to determine if something is not quite right, right? If this is not just my dog's getting old or my cat is getting old, but this is a sign of cognitive dysfunction. And so we do have some tools available to the vet healthcare team that they can share with pet owners to kind of go through and score their senior pets and to look for these kind of subtle signs. So, changes in social interactions, changes in, normal house soiling, sleep wake cycle changes, those things that we kind of in the vet profession know may indicate some early cognitive decline, but that owners may just attribute to kind of normal aging and not really think anything of it. So kind of having owners go through and regularly almost do a report card on their senior pet to say, am I seeing these signs of cognitive dysfunction? Do we need to be intervening with some nutritional therapy is absolutely a tool that you can use. And we're really excited to be able to provide that to pet owners as well because they ask, is this normal? Is this not normal? And if they go to Dr. Google, it's just your pet's getting older. Don't worry about it. But we know there are things that we can do, especially if we can catch these changes early, that can make a big difference for quality of life for the pets, but also if you've ever lived with a senior animal with sleep wake cycle changes, right? That's up in the middle of the night vocalizing like crazy, that is something that affects everybody in the house. So it's nice to be able to maybe say it's not you, you're not just frustrated with your senior pet. This is cognitive decline. And the same way we respect those changes in humans and we have dementia and Alzheimer's and all these, conditions in people that we recognize as being really devastating and not that individual's fault. Same goes for our pet population. So we've got some scoring systems available and definitely, excited to see these in the hands of pet owners so they can kind of take some ownership of this conversation as well and recognize those signs early and bring them up because as you said that time in the exam room is so precious and so limited. So hopefully if we can say, what was your cognitive score this year, this season, as you're seeing these senior pets back and being able to detect changes is going to be really important for having those conversations and then leading us to that kind of right nutrition option.
Absolutely. And, just thinking, of myself and certainly experiences that I've had in the exam room with pet owners on the on the day you take your pet to the vet, and I equate this to like taking my daughter to the pediatrician, right? And it's like I have these questions, even me, like my own doctor's appointments, I'll have these questions in my head, but it throws off the routine of your day and you're, focused on getting from point A to point B and you have to get them home and get back to work, whatever it may be. That I know I have certainly walked out of many a doctor's appointment afterwards and been like, oh, shoot, I meant to bring this up. I meant to tell them that this was going on, and we'll just figure it out next time. Or thinking of the experience in the exam room with pet owners where, like you said, many, I think pet owners will think, oh, they're just getting older. It's not a concern that I have. And so they maybe won't bring it up. Or, like you mentioned, getting frustrated with a senior pet. There can be some feelings of guilt associated with that of like, my dog's getting older. I don't want it to sound like I don't love them anymore or something like
Right.
that. And not recognizing, no, this is actually a problem. So I love that more and more tools are being created in order to put these sheets into pet owners' hands either during the appointment or ahead of time to really help remember those questions while they're there, so we get the chance to discuss all the concerns or point out, maybe there is something abnormal going on here and we do need to address this. This isn't just, oh, they're slowing down because they're getting older and things along those lines. So if we're using these tools and we're getting these assessments and we're saying, okay, we are starting to see some signs of cognitive decline in this patient. You mentioned Dr. Finucci. We had her on the podcast as well, and she is phenomenal. So such a smart lady. Her studies are just amazing. So I'm wondering along those lines with some of the data from working with her, what can we share with clients about the benefit of early intervention when it comes to cognitive decline?
Yeah, and I wish we had more in the vet space, especially. This is such a hot area in human medicine of how can we test for or prevent kind of early onset dementia, early onset Alzheimer's. What can we do to kind of prepare for that and be proactive? And there's so much less always, right? With always so much less in vet medicine that we know about kind of what we can do on the preventative side. I mean, so much of it, I think it focuses on maintaining good activity levels, nutrition, and interaction levels with our pets kind of throughout their life. That's really the thing we know we could probably do the most is pair, high quality nutrition with good quality interactions, right? And so often with cognitive, that's the studies we've got are looking at, and joint health too. The studies we have are looking at, nutrition plus some sort of family intervention, going on walks, doing rehab, engaging in play, doing those sorts of things. So that's really probably the best thing that we can do for kind of dealing with things on the front end. And then it's the awareness that knowing that, this is common. This is common in dogs and cats. And, as they age and pets are living longer, we know it's going to be more common in our older patients. So knowing that we're looking for it, having it on owners' radar, recognizing that senior pets really do have different needs and different metabolism and different, requirements in so many ways for everything from nutrition to their level of interaction and activity, and then making sure owners kind of understand that is probably the best thing that we can do proactively. There's not a whole lot in the research world, I should say, yet, because this is such a hot area. In a year we could come back and have this conversation, or 5 years, and I think we'd say something very different about what can we do even nutritionally early on. But for now, it's about recognizing that this happens and that it's common, especially as our pets get older. And if we can feed them, high quality nutrition that's appropriate for their particular life stage, whether that's, you know, growth or early adulthood or that senior life stage, that we can make a profound difference on their overall health, including their cognitive health.
And it sounds like even just being able to open the door to the conversation about nutrition, because in so many cases, nutrition can be a really hot topic when we're discussing it with pet owners. People have very strong opinions similarly to on the human side. And So if we can identify maybe some of these early signs of joint disease, these early signs of cognitive disease, certainly running blood work, kidney disease, and things along those lines, I think it sounds like it can at least open the door to starting the conversation about, hey, we need to make sure as your pet is aging, and of course, hopefully we're having this conversation their entire life, but sometimes we don't get that opportunity. But as they're getting older and they are developing these comorbidities, to say we really need to make sure we have a targeted nutrition plan to help address these things as they come up and keep them from, running away with us and being much harder to control down the line. It really might give us the opportunity to get these pets on beneficial diets, even if the research for, on cognitive decline and things like that, it might not be there quite yet. At least we can get that conversation started with pet owners and make sure that we're addressing what they are eating so we can stay on top of some of these common comorbidities.
Yeah, I mean, you're speaking my heart language here when you talk about that. And it's so true. We know that pet owners want to talk about nutrition. We know that there is only so much time in the exam room. We know that it can be a hot button issue, but we also know that people really want to do things to help. And everybody, hopefully everybody, is feeding their pet every day, right? So it's actually, in our busy, busy world too, it's such a small lift to make a nutrition change in terms of everybody's daily, habits, activities, routine, but it can make such a profound difference. And so I think, when you look at owners who they sometimes are almost over enthusiastic about trying to intervene, right? We all have those clients who really want to do everything they can possibly do, and they're already feeding their pets. If we can offer them a really customized option to say, hey, this is what I'm seeing in your pet, or this is the age your pet is, this is what we know is going to make a difference, because we do have that great foundational knowledge when it comes to nutrition and what we can do with high quality nutrition. You don't have to change anything you're doing in your day-to-day activity. We're just going to replace what you're already doing with something that's really targeted for your particular pet. And if that pet is a senior, these are the things that we know we're seeing. Here are some, here's a report card that you can start looking for the early signs of cognitive dysfunction. And if any of these are calling out to you as things you're noticing in your pet, let's look at your pet as the individual and adjust what we're doing nutritionally for your pet. And we know that that's really what owners want, is that their pet is seen as, I know I want it for my animals, right? That their pet is seen as the individual that they are, and not just a 15-year-old dog, but it's the 15-year-old dog named, I'll use my dog named Skeeter, who, has a heart problem and a history of cancer and, all of these things. That's the dog in front of us, not just some 15-year-old dog who probably needs a senior food. No, it's the 15-year-old dog in front of us who, has this baggage that they've accumulated over the years, and kind of seeing that, making sure we're recognizing that, and that owners want to do something for that pet in front of them, and that there are now, more and more solutions, sometimes too many solutions, I think, but more and more solutions, or at least options that we can discuss with owners to say, hey, this is the combination of things I'm seeing right in front of me with your particular pet. And in this case, we're talking about brain care and joint. This is the combination of things that I'm most concerned about. Guess what? We can do something kind of just for this combination of conditions. And all you have to do is do the thing you're already doing, feed your pet every day, but we can make a really big difference here. That's ultimately why I love nutrition, is that it can affect every pet. You know, every pet is eating something. So I argue I have the best specialty in the world, because, maybe behaviorists can argue too that every pet has a behavior, but every pet's eating something. So we can make a really significant impact. And I think it's absolutely something owners want. And if we aren't having those conversations and kind of giving them that direction, there's plenty of, things online they'll find, and things that they can kind of spend money on that we know don't actually make a difference, right? But they want to do something. So if we can kind of guide them towards the things we know have evidence behind them and studies to support that they work, that's absolutely what we should always be doing. And in the nutrition world, we can do that.
You make such a good point there, because it can be scary as your pet is getting older. I don't have my senior girl anymore, but she was the 15-year-old dog named Patches, to go along with Skeeter there. And she absolutely had cognitive decline. She benefited from BD. But I mean, it can be hard to accept as you start to, even for me as a veterinarian who, I knew what I was looking at, I knew what was going on, but it was hard to really open my eyes to that and say, oh, you're getting older and we are going to have to start addressing these. And I think, along the lines of it sort of being, a little bit scary to think of our pets as getting older, when we're recommending medications, that can kind of feel like, oh wow, like they really are older. I really like now we're really having to start to do things and can be hard to wrap your head around, at least from my personal experience. And so I love the idea of, certainly use medications if they're indicated, not taking
Sure,
away
sure.
from
Yeah.
medications, but to talk to an owner and say, hey, like you said, something you're doing anyway. You're already feeding your animal. Let's go ahead and use this evidence-based diet that can help address these. And it seems like it would be to me, and I think it, probably to other people as well, a little bit less scary to change my pet's diet than it is to say, okay, we have to start this long-term medication or something like that. Yet, to your point, like you said, we can make such a big difference with nutrition in a way that might feel a little more comfortable.
Yeah, absolutely. And it doesn't the other reason I could talk about why I love nutrition, lots of reasons, but it's besides it being something that owners are already doing and for some owners a lot more palatable than starting medications or maybe a boatload of supplements. It also doesn't come with potential side effects, and even
Hmm.
supplements can certainly have side effects. So when it's all kind of been packaged, that's kind of the beauty of a therapeutic food in my mind is everything's really been packaged perfectly. You don't, it takes the guesswork out of adjusting doses and trying to figure out how much do I give and it's all in there in kind of a perfect little package for you and it makes it easy but also just very safe to do that change. And I think again when we're talking about senior pets, I'm thinking of the last conversation I had with some of my vet team on my own dog. It's like, it's that game of whack-a-mole where like, do we change one thing and then it causes another thing to flare? Do we
Hmm.
change, when we kind of can provide something that is prepackaged into a nice, like this is not going to do any harm. It can really only do good. And we don't have to play around with doses and recheck the blood work 10 million times to make sure that we've got the right dose and that we're not seeing any toxicity. Again, I feel like I'm like flashing back to my own current senior dog's life where like we're
Aw.
constantly making adjustments and then, monitoring his blood work and things like that. But I feel good that I know, what, he's on this like stable plane of nutrition that's providing him with, the joint support that he needs. It's providing him with the cognitive support that he needs. And we don't have to worry about that part, right? That part's set. And if, we can do that with food, it's such a nice thing for owners as well as I think for us as veterinarians to know, okay, we've got that box checked. We're dealing with everything we can do nutritionally. Now we can focus on the nitty-gritty of making these, minuscule adjustments to dosings and trying different meds and things like that. Because that's really, I think, some of the art of vet med is
Hmm.
is trying to figure out how to do all of those small changes. But we're trying to make it easy, and I think, that's been a goal of Hills for a while is to try to make it easy and have lots of options so that the vet healthcare team can say, this is the pet in front of me. What matches it the best? How can I customize this the closest to the patient in front of me and kind of put a big check mark into I'm dealing with things nutritionally as best I can.
Absolutely. And the fact that Hills is continuing to try to make it easy and we're seeing so many more options, just across the board to manage multiple comorbidities with nutrition. It's definitely helping out on the general practitioner side to to help address these and keep our patients in this stable plane of nutrition. So Dr. Ruggiero, I just want to thank you so much for coming on the podcast and talking about all of this. It sounds like a really exciting diet, and I love the conversation around client interaction because that's so much of it, and it's so important. So, thank you so much for joining me.
Well, thank you. Yeah, it's been fun to talk about, and I'm excited to hear what people think of this new Brain Care Plus JD. Excited to get I feel like this is one of those foods that we're going to get lots of feel good stories from, of folks trying it and pets really, having a big change that owners feel good about, and that's really why we're all doing it, right? So I appreciate you chatting with me about it, and I hope we'll talk again soon.
Absolutely. Thanks again. Thank you so much to everyone for tuning into this episode. I hope you learned a lot. I'm so excited to see more and more of these kind of multimodal nutritional options, especially when it comes to managing our aging patients who can present any number of challenges. I want to say a huge thank you to Hills for making this episode possible, and thank you to Dr. Ruggiero for joining me and for all of your expertise. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you enjoyed this episode, you can find more by checking out the VetFolio website or listen wherever you get your podcasts. We are always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM or follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.